Well, we're back, unfortunately. Well, unless you've been hiding under a rock, you know all about COVID and the rise of the Delta variant in not just Cobb County, but really across the country. So let's get right to it. We're talking with Dr. Janet Memark, the head of Cobb and Douglas Public Health here, about how the numbers look.
All right, so I didn't think we would be back here again so soon, but we're having another bit of a surge right now. And so right now, over the last few weeks, we've seen an increase in numbers and our case rate. I know how long did we get to celebrate this time? We celebrated for a little bit, going below 100 cases per 100,000, but we are up to 235 cases per 100,000 since last night. That's our 2-week case rate, so that has blown us past high transmission. And so, when I heard today our numbers are looking even worse today, so we are in some pretty high transmission right now of the COVID virus, and then we also have some higher percentage positive numbers too. So we're up to 8.4% positive of the tests that are coming in. We were under 2% at one point, so we had low transmission rates and low transmission numbers, but now each out of every 100 that's coming in, at least 8.4 are positive, and that doesn't include the home ones that people are doing as well.
So who are these people getting sick? What are you seeing as far as those numbers?
What we're seeing right now is we're seeing younger folks that are getting sick, and they're almost exclusively the unvaccinated. This new variant, this is the Delta variant that is causing all of this. Numbers right now look that it's about at least 80% of the virus that's circulating is the Delta variant. Now, what do we know about it? We know it's very, very transmissible. It's thought to be over 200% more contagious than the original COVID virus. People are asking me, is it more deadly? Well, it's more deadly for people that are unvaccinated. So far what we're seeing is that almost everybody in the hospitals or that are dying from this are almost exclusively the unvaccinated folks. Now, we are seeing more breakthrough infections, and we've talked about this before, how if we keep letting the virus continue to circulate and to reproduce, it is going to find a way to beat us. It has been able to make some progress against the vaccine, which means that some people who are fully vaccinated could still come back positive and maybe have some mild symptoms. But your chances of dying or being hospitalized are still extremely rare if you are vaccinated. It's the unvaccinated folks that's really taking advantage of at this point.
So that brings me to my next question, which is the new buzzword with COVID is breakthrough cases. And I think a lot of people are using that as a argument that the vaccines really aren't that effective after all.
So that's a great question. I'm hearing a lot of this as well. So yes, we are seeing here in the United States as well as in Israel and in Singapore, there are more people that are getting COVID even though they're vaccinated. So remember when we first started, we had 90 to 94% efficacy of the vaccine. Now we are seeing more breakthrough cases, okay? So yes, people who are vaccinated are getting infected more. But here's what's very, very important is they are not dying and they're not being hospitalized. It is rare, it can happen, but it's very rare. So this vaccine is working the way it was intended to work. Now, that's going to lead us to the next thing, though, but is talking about new CDC recommendations. But before we get there, I just wanted to mention that right now what we're seeing is hospitalization rates in our district. In Cobb County, we have over 300% more hospitalizations for COVID than we had just a few weeks ago. And so our hospitals are once again filling up with COVID patients. They are younger patients, 30s and 40s and 50s, and they are unvaccinated. In our Douglas County district, in the county right next to us, we have over 10 times more patients than we had just a few weeks ago. And so, but this is unvaccinated folks that are being hospitalized or dying. The deaths are starting to come in to us again, once again.
So you talked about the new CDC guidelines. I guess these are going to come out of storage for a lot of people.
Yes, so we have our masks back into your cars and everywhere that you're going. Now, I know that this is very confusing and that it seems like we've been going back and forth on this. This virus is very, very stealthy and very smart. And remember, it's the novel coronavirus. We have learned more and more every step of the way. So we were doing pretty good. We're doing good against the Alpha variant. We're doing good against the Beta. Now we've hit Delta. Delta seems to be able to transmit better than all the other variants. And so we are getting some vaccinated folks that are actually able to get infected, but mild infections, it seems like. And so now, because we have such high rates, and it depends a lot on that too. We have such high rates, it's recommended that if you're going to go indoors publicly around folks, that you should wear your mask, because the rate of transmission is so high right now. Now, this is what I hope, is that we are able to get this back down again, and then we can ditch these again for a while. But in the meantime, right now, it is very, very high. And there is some thought that even vaccinated folks with the minor symptoms can transmit it, or no symptoms. So that's why we have to be a little cautious as we bring this back down.
So if there's one thing that bothers me the most about the timing of this, I guess we're going to call it a surge, I don't know, but is that school starts here in Cobb County at least next week. Yeah. So what advice do you have about parents who may be now second guessing their choices about how their kids will learn this fall?
Yeah, I'm in that boat as well, right? I have 2 children that are also in the school system. And so, my best advice is that you go with the CDC recommendations. They are that, everybody in K through 12 need to wear their masks. And one of the main reasons for this is we have a very large group of people that were unable to get the vaccine, or were not, they're not qualified to get the vaccine. They're 12 and under. And you got a lot of kids that are not vaccinated. So I would say you have the majority of folks that are not vaccinated in those school buildings. And we have this virus circulating widely right now. So everybody needs to wear their mask. Now, that's not to say that it's going to be permanently like this. Now, if you had asked me just a month ago, we may have been okay. Honestly, if we had enough vaccinated folks and we were at 40 cases per 100,000, I would have felt like we were much safer than we are now. Now, hovering over 200 cases per 100,000, that's an undercount. It is circulating. And so, I've had this discussion with my kid's dad is, what to do about our unvaccinated child. He's going to go in with the mask and try, they're just going to try our best. But the thing that makes me feel better is my entire family and my elderly mom is vaccinated. So the downstream effect is, I pray he doesn't get infected, but if he does, everybody else is protected. And so at least I don't have to worry about my mom dying or us dying from this. And so that actually helps me to sleep at night. But he will be wearing his mask, as well as my vaccinated daughter. So everybody should be wearing their masks during these times, and hopefully the numbers will come down and we can revisit it again.
So when I'm in the hallways talking to my coworkers and among my friends, and we bring up the Delta variant and COVID, inevitably the emotion is just immense frustration. And it's got to be that way for you all as well, because as you mentioned, it looked like we were doing so well for quite a while this summer, and we thought we'd go into the school year with this behind us.
Yeah, so, remember when we had talked a few weeks ago, maybe a few months ago, when Delta first came out, that this was a race, right? We had a race against how many people we can vaccinate versus the Delta variant, how quickly it took over. It won the race. So it has gone faster than we can vaccinate. And so it is frustrating, but, I really hope that we can all kind of get on board and, either get vaccinated or wear your mask. You know what I mean? That's the only way that we're going to bring this down. And the only way that we're going to be able to take care of all of this, whoever you need to talk to, if you need to talk to your doctor about it, there are a lot of myths, but there's a lot of misinformation out there on social media. Please go to trusted sources about this, and do not listen to folks that are perpetuating lies on the internet. So go to people that you can trust about this.
So here we are once again. It's time to get the masks back out of storage and wear them when you're near others and indoor, whether you're vaccinated or unvaccinated. Get tests. If you're not feeling right, those tests are available all across Cobb County, and of course the vaccines. They are also available everywhere. Go to cobbanddouglaspublichealth.com to find the nearest vaccination site near you.